To Chennai, from north to south, where with over 33,000 COVID-19 cases, Tamil Nadu has been recording more than 1,000 new cases every single day over the past few days. And what's making it more worrisome is the fact that most cases are being reported from the city of Chennai. India Today's Shalini Lobo conducted a reality check on the availability of beds at Chennai's top hospitals. Take a look at what she found.
Tamil Nadu, especially Chennai, is witnessing big daily surge in number of COVID cases. But hospitals, which should be at the forefront of the corona fight, are struggling. Dwindling beds is a common evil plaguing private hospitals on state government's list.
I have a relative who is a COVID positive patient, and we want to shift him from Omandurar to the hospital. So I wanted to know what the tariff charges were like per day.
Ma'am, sorry ma'am, here no beds are available ma'am. Beds are all full.
Ma'am, I want to know the price for corona beds, if there are beds available in the hospital. There's not even one bed available.
So ma'am, sorry ma'am.
There are no beds available in the hospital.
No ma'am.
I wanted to know about the admission charges for a COVID patient in Vijaya Hospital. I want to
Madam, at the
transfer.
present better vacant illa ma'am. One day 30 to 40,000 something varum ma'am.
But there's a government cap on it now, no? There's a government cap, 7,500 plus 5,000 rupees or something like
But
that.
at the present better vacant illa ma'am.
If you're lucky enough to get a bed, be ready for a rude shock as you will be charged a bombshell for the treatment. India Today has accessed bills running into 3 lakh rupees for a week of treatment. After massive discontent, the state government has capped prices. The government fixed a fee of 5,000 a day for non-critical cases with additional cost of 3,500 for miscellaneous charges. For those in ICU, the cap is 15,000 a day, with an additional management charge of 6,500 for those who don't need ventilator. It's 8,500 rupees a day for those needing ventilator support. India Today decided to find out if hospitals are following the capped fee norms.
I'm thinking of shifting a family member who's COVID positive from a government facility into a private facility, and I'd like to know the per day charges.
In general ward, we don't have beds for the patient cot. We have only the attendant cot. It's very small. And second thing, per day, 17 to 20,000 will be the charges.
Okay, but
Right now, we don't have the bed available. I can put it in the list. Government has been implemented that one, but still we didn't receive the GO, ma'am.
okay. So there is a possibility that will change even post-admission if he gets a bed?
I'm not sure about that one. We have to talk to the management later on. And once
You heard that right. Rupees 17 to 20,000 for a general bed, whose price is fixed at 8,500 by the state government. Hospital staff say they are yet to implement government prices.
So I'm looking at hospital options, so I just wanted to know how much it would cost me.
If you want to put any oxygen facilities related,
Okay.
per day they cost around 20,000 rupees, ma'am.
Oh.
15 to 20.
Okay, this is with the new government cap in place, because I heard government has given some restrictions on expense in private hospitals.
Based on that, ma'am, we don't know. We don't find out that patient, no?
I'm just calling up hospitals to see the facilities that they have and the price range also, because some hospitals are too expensive. So I just wanted to know what exactly the price range also will come up to for the ward facility.
Must be around 1 lakh per 1 lakh
Per?
1.5.
For
1.5 for 7 days.
for 7 days. This comes under the other cap itself.
Yes.
While the government order puts the cap at around 60,000, these hospitals are asking for over 1.5 lakh rupees for a week. Tamil Nadu doctors' body says the government cap is not feasible as hospitals incur additional cost of staff quarantine, PPEs, ventilators and labs. Can the state government end fleecing of patients and ensure private hospitals don't turn red?
Private hospitals are full and do not have enough beds to take in new COVID positive patients. They also tell us that they're yet to revise their prices as per the government order. Now, this indeed does pose a problem for the Tamil Nadu government, as Chennai records over 1,000 cases every single day, and this has been the trend over the past 1 week. With video journalist Divyan Rajkumar, this is Shalini Lobo in Chennai for India Today.
Shalini is live with me from Chennai. She's just conducted that reality check of hospitals there. Shalini, this doesn't sound good. This doesn't sound like Chennai's hospitals are ready to take on this load, especially at a time when the city has seen a steady spike in cases.
Indeed, Shiv, at a time when the city of Chennai has seen over 1,000 cases every single day for the past 1 week, we call up private hospitals and many of them say there are no beds. This is, of course, due to the increasing number of cases. But another very important factor is that they have not revised their rates yet.
Yes.
Currently, with the government cap, a general bed in a ward, including your oxygen, including your nebulizer, should charge you around 8,500. Give or take, let's say, another 5,000 for your heavy medication, for your intervention, for your heavy investigation and lab processes. You can probably charge another 5,000 a day, but still they're asking for around 17 to 20,000 per bed in a general ward. One hospital as well told us that they are yet to implement these rates because the management has to take that call. Apart from that, another hospital tells us that the entire package for 1 week comes up to 1.5 lakh for a COVID patient in a general ward. Now, if you calculate the government rates, it should come up to somewhere between around 60,000 rupees.
Yeah.
Not more. You want to give and take another 20,000, go ahead. But 1.5 lakh again is steep. So
Incredible.
the government probably now has to look into the private hospitals and talk to them about what can they re-evaluate.
Yes.
I spoke to the secretary of the Tamil Nadu Indian Medical Association and they told us that the government can afford to run at such cheap rates on public money, but we can't afford to do that. They had spoken to the government about acquiring PPE kits at a low rate. However, that hasn't been done yet. They haven't got a call back from the government asking them where they can pick up their equipment from or where the PPE will be delivered so that they can access it. Another thing they have approached the government for is to take over the quarantine facilities of their staff, because after every 7 days, the staff has to go into a quarantine facility and then come out. So they want the government to take over that as well. And the last request is, if you can't work with us, then you take over our facilities. We will give you the space, the infrastructure and the staff. Asking the government to pay them for their services, take over their insurance, take over their quarantine charges as well, and work through this pandemic.
Okay, hopefully that will align itself, because Chennai cannot afford even a little bit of a discrepancy between the hospitals and what the government requires, especially given the huge spike in cases over the last few days. Shalini, thank you very much for getting us that big reality check, something very much to think about for the people of Chennai.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.